It is 12 noon, and we want to thank you for joining us for the Flint Community webinar on coronavirus. And this is sponsored by the Healthy Flint Research Coordinating Center right here in the city of Flint. My name is Yvonne Lewis. I'm moderating this session today and have just been so excited with this partnership team of community partners, academic partners, to bring this webinar to you. I've been now facilitating these webinars for 23 weeks. If we can go to the next slide. Thank you, everybody there. That's me. Good afternoon. And we'll go to the next slide. For 23 weeks, we've brought this webinar to you, and we're so excited to be able to do this with our wonderful partners. And you'll see the banner of partners. I just want to let you know that really our intention here was to bring to you a community perspective on a global pandemic. Even though this has been happening around this nation and around this world since the end of December, we are so thankful that we've been able to galvanize these community partners from our hospital systems, community organizations, locally, Consumers Energy, as you can see here, the Michigan Public Health Institute. Our own governor's office has been on with us regularly, along with the Michigan Department of Health and Human Services, Genesee Intermediate School Districts, and the Flint Community Schools. We have today a very important and exciting webinar for you, and we're glad that you joined us. If you've joined us by YouTube and perhaps not able to see all of the slides, we want to encourage you to go and visit the webinars at a later time and make sure that we're able to answer any questions that you might have. You can put those questions right in our queue. Today, we're asking each one of you to put questions right in the queue in order for us to make sure that we're able to respond to you today. As many of you have already noticed, that when you respond and ask those questions, if there are things that we need to correct, we will do that as soon as we can, even in the course of the webinar. So if you're listening and you've just tuned in by phone, we want you to know that you can also send questions in today. You can text us at 810-835-2130. Please give us a text with your question at 810-835-2130, because we think today you may have some questions as you hear our webinar, the information that we're going to be sharing with you today. I want to just give you a tip. In the event that you know some friends, family members within our community or outside of our community that recognize the impact that the Flint water crisis had on the residents of Flint. And I'm sure by now you have all heard that there was a preliminary settlement. We're going to have guests on with us at the end of second half hour of our program today. So if you have friends that you want to know for themselves and hear directly from us, please take a moment, text them, send them an email, and invite them to join our webinar today. They can join us today at info@hfrcc.org. They can go there and get registered. And I still think they can get in the webinar today. So please call them and let them know that we're going to have this very important topic that we will be discussing today. As we move forward today in our webinar, we are excited that our partners, and you see our partners here every week, are on the call. They are ready to receive your questions in the queue even now. So as you're looking and you have questions from our hospital systems, from our MTA, from the school systems. I know our schools haven't been able to be on with us for the last few weeks, but if you put those questions in there, we'll make sure that we get those questions answered for you. The Genesee Health Plan is still here to help us respond to some of these questions. The Greater Flint Health Coalition here to answer questions for you today. You may have a question about community ethics and how our Community Ethics Review Board is helping to monitor the things that are happening. So the CBOP serve is here with a representative to answer questions for you, along with representatives from Michigan State University, the University of Michigan Flint. Help us make this one of the best webinars we've had, because you're involved and you're helping us to make a difference. So today, we're going to begin today by hearing from our city representative. Dr. Lawrence Reynolds is one of our key partners, and I told him today he is my hero, because Dr. Reynolds, as you can see, He is raising the flag about the things that need to be made available for us in the city of Flint. So I want to invite Dr. Reynolds now to give us an update from the city of Flint. And one of the things we know we're going to talk about today is there was a change. Fast start now is get the lead out. Dr. Reynolds. Can you unmute yourself, Dr. Reynolds? There you go.
Yes. Fast start is now get the lead out. Now, there are 3 important messages. Number 1, don't say no, I don't need it if you haven't seen somebody digging in your lawn. Number 2, the deadline for making the let out program, I almost said the old name, is that you contact the city contact this number by September 18th, 2020. I'm talking about less than 4 weeks from now. And the numbers you can call are 232-2558. And you'll get Jennifer Allen at Rowe. That's the contractor. If you leave a voicemail, leave your name, your address, and your phone number. You can also call 810-410-1133, and they will transfer you to that number without giving you that number. But now you have 2 numbers, 232-2558 or 810-410-1133. September 18th is the deadline. Now, there are many in the audience who said, well, I did this last year and nothing's happened. Well, remember, last year was under a different administration. And so we have to make sure that whatever information you gave prior to March 2019 is current. So please, if you called that number, any of those numbers before March 19th, March 2019, please call and give that information again so you do not get missed. Have I been clear on that, Sister Lewis?
Yes, sir, Brother Lawrence Reynolds. Doctor, you have been clear on that. I want you to clear one other thing for us, though, as we go to our next slide. We've been talking about the census. And just like you've given us an update on the date for the shifting, September 18th for get the lead out, we had last week talked about the change in the date with respect to the census. I know Brother Tony is not able to be here with us today, but we want to make sure that we are talking about this census question.
All right. Well, you know, Brother Tony is my hero, so I will try to approach the way he does things. But September is a busy month for us. Now, remember, people of color were either not counted or counted as 3/5 of a person. And if you recall, yesterday, August 20th, was the 400th anniversary of enslaved Africans being brought to Virginia. We must make sure we count as one, a whole person. So please answer the census. That determines what the schools get, what the roads get, what Medicaid gets. It determines all these government services. And most importantly, it determines how much representation we have in the United States House of Representatives. It determines so many things. So there are 41 days left. Okay, I'll take that as a fact. Enumerators or people from the Census Bureau will come to your door. They came to my mother's door and we watched him on Ring. And they are very professional. They have ID. You can answer their questions. If you're uncomfortable answering their questions, you can call in or go online. But please, when you see someone standing at your door with that lanyard around their neck and that card, that ID card, please cooperate with them. Otherwise, you become less than 3/5 of a person for the next 10 years. Have I been clear on that, Sister Lewis?
Brother, you got it right. Thank
right.
you. And we're counting down. That's why we call it the countdown. We're counting down. It is so incredibly important, as you said, that everyone understands the importance of their voice.
And
We
one more
count with,
thing,
yes, sir. I know you got
not re-
something else. Come on.
not related to the census, and
Okay.
that is, you may notice that the drugstore chains now have the influenza vaccine available for the coming flu season. Get it now. Now, I should advise you all there's another problem that exists and probably throughout the country. Some businesses, drugstore chains, are getting the vaccine before your doctor's office, before the health department, before our federally qualified health centers like Hamilton. Get it as soon as you can. Call the drugstore. Tell them what insurance you have or what insurance you don't have. Find out how much it costs. Find out if it's covered by your insurance plan. But get it as early as possible. And I've challenged the powers that be. You all got to help us get vaccines out in all those other venues so that we can protect people in the coming flu season, and it reduces the problem we have of answering the question, is this the flu or is this COVID-19? And I'm done.
Well, Dr. Reynolds, you tapped into one of the questions that came forward from one of our webinar participants today, and it's sliced, it's sandwiched right between. We're going to hear from the health department in a moment, but the question was, flu season is upon us, and we know it's actually been here all year if we think about it. But given that, there is concern about the difference between flu and COVID-like symptoms. And how do people tell the difference, and how long will the flu last? So I just want to let our listeners know we're actually going to be planning a special session to talk about this, because there's some other things that we need to get some answers to and have consideration for as to how our community will prepare. And so, Dr. Reynolds, I just want to give this distinction. He is the health advisor for the city of Flint, but I'm feeling like he's the doctor for the city of Flint, because he touches on everything related to our health and well-being. So we appreciate that, Dr. Reynolds. And so this question that our listener has up, did you want to respond to it? And then I'm going to go to hear what the health department has to say as well.
Oh, yes. Okay, if I were still in practice and you walked into my office and you had a temp and URI symptoms and a cough in flu season, and you asked me, Doc, do I have influenza or do I have COVID? What I would tell you is, I don't know. This is why I have to do these tests. There is a test for influenza. There is a vaccine for influenza. So if you cooperate and get that influenza vaccine now or as early as possible, we can still test you in the office. There are even treatments for influenza. But at this point, there are none for COVID-19. So I'd be deceiving you if I said I could tell the difference. And that's when you must insist on a test. So if you feel sick, if you have any symptoms, and I'm making it broad, including loss of smell and taste, rapid breathing, cough, high fever, or if you are caring for someone who has COVID-19, or if you leave the house to go to work, and I will add, or if you leave the house to go to school, and you have those questions, you need to get tested. The challenge is the capacity for testing is limited. So it's important that if you have a problem, you get tested as soon as you are concerned about that. And one test applies for that moment. It does not apply for what may happen a week from now for COVID-19. So please get your influenza shot. If you have any symptoms, if you leave the house, go get tested. And lastly, as all my colleagues will say, wash your hands, wear your mask, avoid crowds. And please look out for the people you love. And as I've said before, look out for the people you hate, because they may know someone you love.
Wow, Doc, that's really significant. And in the old school, we would say that's heavy, but it's very important. And thank you for raising that. And we appreciate you. So again, Dr. Reynolds is here. Put some questions in the queue. He'll be there to answer them for you. Suzanne Kupel, representing the Genesee County Health Department, has been with us and consistently brings forward relevant information for you and our community. Suzanne.
Dr. Reynolds stole my thunder. I wanted to, I always give you an update on the numbers in Genesee County, but he's absolutely right. The flu vaccine's available. Take advantage of it. Recognize that you can get a flu immunization also at the health department, and that we are doing immunizations by appointment. So call ahead, make an appointment, recognize that we're social distancing and that we are checking temperatures and asking screening questions, limiting the number of people in our waiting room. But you can come to our health department as you call ahead and make those appointments. Recognize there are plenty of locations in our community to get flu immunizations, and definitely want to make sure that you take advantage of them. Last week, we kind of walked through our health department website, and the slides that you are seeing right now are related to that conversation. I really wanted to focus in a little bit more about our case numbers and tell you some of the things that we're working on. So I always tell you that as of yesterday, for our 2 p.m. posting to our website, we had 3,086 positive COVID-19 test results and 275 deaths. Again, it's a reminder that this is not reflective of all the cases of COVID-19 that have been likely in our community because we had limited testing at the beginning of the pandemic. I did want to start adding the positivity rate, and a lot of people have asked a question about what does that mean. The World Health Organization, the governor's phase plan, and others have talked a lot about this positivity rate as a measure for how much testing is needed in our community, but also whether or not we need to move back a phase or move forward a phase, just trying to recognize where we are. And the World Health Organization says anything over 5% we need to be worried about. I'm happy to say that as of right now, the positivity rate in Genesee County is 2.7%. So we have been making improvements. What we're seeing in our community is more cases in younger people. So we're seeing a steady plateau of the number of cases in our community, but we're seeing more cases in young people who don't require hospitalization. But that's a recognition, again, that if young people are exposed, they're going home to family members, as Dr. Reynolds pointed out, where they're exposing someone that they love. And so we want to make sure everyone is appropriately social distancing, wearing their mask, using hand sanitizers, washing their hands, and doing all of that. Yvonne alluded that we are going to plan for a conversation about what we're doing right now, planning for when we have a COVID-19 vaccination, and all the things that go into that planning process, so you're all prepared and you have an idea of what we will be working on and what we're going to be engaging you in as part of that process. So I also want to remind everyone that there have been a number of concerns about going to the hospital for care. And we do not want someone who's having a heart attack or a stroke to wait and go for a doctor's appointment or try to go to an urgent care. Go to the emergency room. That's what they're there for. That they are the individuals that are most prepared to address those types of emergent health conditions. It's safe to go there, but that's where you need to go. So please don't be afraid to go and get treatment at an emergency room. The other thing I want to remind everyone is that this is also a time where it's really important to take care of your health, both your physical and your mental health. Make sure you're eating right, that you're exercising, that you're reducing your stress level, that you are doing things that you enjoy, planning things with family and friends, even if it's in a virtual environment. But recognize that that is also an important part of protecting yourself from COVID-19. So don't forget to visit your doctor, have a medical home, talk with them if you're having changes in your medical status. Make sure that you're doing everything that you can to protect your own health. And I look forward to bringing you more information about our testing locations. We know that we have 3 locations that are going to be coming up in our community in September, and I'm hoping to have a significant update for you next week about the 3 community sites. We still have the Rite Aid location in Swartz Creek and in Flint. Hamilton Community Health Network continues to offer testing at their North Point Clinic and at the Burton Fire Station, which is at the corner of Bristol and South Saginaw. And the Walmart Supercenter on Corona Road is still offering testing. So those locations continue to offer testing in our community. We have 3 more that are coming up in September, and I look forward to providing you an update on those 3 locations next week.
Suzanne, we really appreciate what you've just shared. I have one other thing I'd like you to focus in as we go to our next slide. We want to remind our listeners that even though we don't have a representative from the school today, schools are in the reopening process. Right now, our schools are reopening virtually, but we do understand some of our schools will be opening for in-class participation. Some of our smaller classrooms from the Genesee Intermediate School District have already opened up some small classes. But Susan, can you talk, you spoke about the testing sites. Can you just give us a little bit of information about the new sites and what's going to be available for children?
Yes, so the new sites will be able to offer pediatric testing. So they are going to be open to testing for everyone. We're working to make sure that they will be available to help with translation for language for anyone where English is not their primary language. For the deaf and hard of hearing community, that there will be sign language interpreters available. We will also make sure that for those who may not have an ID, may not have documentation, that they're going to be able to access those locations. There have been site visits that have already been conducted to make sure that for anyone who has a physical disability, they would be able to enter and exit the building. We're starting with the testing for COVID-19, but hopefully there will be an opportunity to offer other services, maybe even the flu shot. So there are some other things that we're working on for the future. And so we will keep you informed on what's going on, but most definitely those locations will be able to offer testing for children. I will remind everyone that if you are going to either the Rite Aid pharmacy or the Walmart location, call ahead when you're making your appointment, make sure that you've got all those details taken care of. And then when you're visiting with Hamilton, as part of that intake process, you'll identify whether it's an adult or a child being tested.
Thank you so much, Suzanne. Appreciate that information. And one of the things you mentioned in your earlier sharing was that we needed to take care of ourselves and particularly take care of our mental health. And we wanted to remind our listeners that we do have the Genesee Health Systems, and we're which is our community mental health. This is what we used to call them years ago before the name change. And today we have a representative from the Genesee Health System, Elizabeth Birch, who has been a great partner, and we worked together for a number of years here in our community. And she's going to share with us some information about the supports that are available for our community with respect to mental health. Elizabeth.
I can't believe I did that. I was muted. I'm so sorry.
That's
Thank
okay.
you so much. I just hate when that happens. It's so awful. Thank you, Yvonne, so much. I'm so excited to be a part of this. You are an amazing moderator and very positive voice for the Flint community. So thank you so much for that. Like Yvonne mentioned, I work at Genesee Health System. My official job title is Director of Children's Services, Outreach Prevention and Low Intensity. And I'm here today to just chat with you guys a little bit about the services that are in my department that were originally created in regards to the Flint water crisis. And I want to remind you guys of those services and also give you an update of sort of how we've been functioning during COVID-19. So Family Supports and the Neurodevelopmental Center for Excellence are both programs that were created as a result of the Flint water crisis and an attempt to really do some thorough assessment and mitigate any potential effects of the lead exposure on our children. So I just wanted to let everybody know that we're still providing services virtually right now. We're still taking referrals. We're trying to do everything business as usual, just remotely. And I know that many people can relate to some of the earlier challenges of that, but I think that we figured it out. Just a reminder that the Family Supports Program is for children who are up to the age of 21 or pregnant women that were impacted by the Flint water crisis, and also have that special Flint Medicaid waiver, which was approved in order to provide broader coverage to our kids who were exposed to the water. This program provides an assessment by a social worker, and then 5 follow-up, what we call case management visits per child in the home that has that benefit. So if you've got 3 kids, that's 3 assessments and 15 case management visits. And really, the purpose of this program is we don't know what the long-term effects of the lead exposure on each individual child are going to be. So even if your child isn't necessarily having, big issues, we want to encourage people to be in this program because it's so much better to be already involved with a social worker, already involved in a system, and you're working with someone. And then, if things come up later, like in school, or they're having trouble socially or with impulse control, you're already sort of connected to a supportive person who can assist you in figuring out what the needs are for your child. So we really encourage families to sign up for the program. If you have the Medicaid waiver, obviously it's free of charge. Pre-COVID, it would all be home-based. And like I said, right now we're doing virtually, but hope to resume face-to-face contact soon in that program. In terms of the Neurodevelopmental Center for Excellence, so this is the program that does the full neurodevelopmental assessments. They're about 4 hours long. It's a very in-depth assessment and testing process. And the NCE did begin doing their face-to-face assessments this week. So they did only like 1 a day, which is less than what they would have done pre-COVID, but they wanted to make sure they really got the protocols and everything down for safety. And so we are continuing to evaluate that and make sure that our procedures and everything are as safe as they can be. And we look forward to continuing to provide those critical assessments for our kids. And I would also encourage everyone to go to our website. You can actually submit a request for a referral for your child right on our website. Someone will call you and give you an idea of what the wait time is right now, because we are backed up due to not providing assessments for several months during COVID. So I would highly encourage parents to look into that. It is a resource in our community that is amazing, and I've seen the recommendations that the neuropsychologists come up with are very thorough and life-changing, to be honest with you. There's just a lot that goes on in that assessment. So I don't know if
Thank you, Elizabeth. You've covered that. Just want to make sure, if you could for a moment, the Neurodevelopment Center is actually located on the corner of 5th Avenue, or we call it Robert T. Longway and Dorr Highway. And so, I know your office is on Mackin Road, but the Neurodevelopment Center is actually on 5th, Robert T. Longway and Dorr Highway, for those that are wondering where that facility actually is located. So Elizabeth, thank you so much for sharing. I know you'll be back. I received a commitment from Dan Russell, who is the CEO of the health system, that someone from GHS or the Genesee Health System will be here to help us answer questions. And I want to emphasize too, when she talked about the Medicaid waiver, for all of you that are not aware, that waiver was available the Greater Flint Health Coalition is also assisting along with helping to get individuals signed up for that Medicaid waiver. And so we want to talk a little bit more about that too at a later date. But we want to just encourage you, please make sure you acknowledge if you're in need of any of these services and reach out to make sure that your family can get the services that they need. So again, thank you, Elizabeth, for being on. Now, right here, we would hear from Gary Jones. But a few minutes before the webinar, Gary Jones let me know that he was not going to be able to attend because there's a lot going on, as all of you know. I'm sure you've heard the announcement yesterday about the preliminary lawsuit settlement, but I want to just reemphasize you. If you want to get all of the information that Gary will share, please give him a call at 517-282-3193, or you can email him at jonesg9@michigan.gov. Now, I cannot do what Gary does every week, but he did ask me to share something with you today. So I will begin with this. And you can go on the state's website, which we will provide for you in a moment, and you'll be able to hear directly some of the comments from our governor. But he did ask me to share. Last week, the state of Michigan agreed to a $600 million settlement of the civil lawsuit brought against the state of Michigan by Flint residents after the water supply for the city of Flint was switched to the Flint River on April 25th, 2014. What happened in Flint should never have happened, and financial compensation with this settlement is just one of the many ways we can continue to show our support for the city of Flint and its families. These are words from the governor. They're continuing to work with the city of Flint to complete the pipe replacement program, which you heard Dr. Reynolds talk about earlier, get the lead out. There's some additional programs and services which include, and not limited to, but include nutrition programs, services for our seniors, and the lead abatement and prevention program. There are other services. And so the governor wants to leave us with this. With this partial settlement, we acknowledge that this settlement may not completely provide all that the Flint residents need, and that many will still feel justifiably frustration with a system and structure that at times is not adequate to fully address what has happened to the people in Flint for the last 6 years. We hear and respect those voices and understand that healing Flint will take a long time, but our ongoing efforts and today's settlement announcement are important steps in helping all of us move forward. I want to encourage you to go on the Michigan.gov website and listen for yourself the words from our governor. All of us have to make decisions about how we will function in this time. We're delighted today that we have an opportunity to hear from some of the legal representatives who have been working toward getting to this day, well, it actually happened last week, but getting us to this point where we can understand what the remedies are. And again, I want to just emphasize this one thing that the governor has said. They acknowledge this settlement may not completely provide all that Flint needs, and that many will still feel justifiable frustration with a system and structure that at times is not adequate to fully address what has happened to the people in Flint over the last 6 years. I think it's very important for us to hear that so that we understand there are opportunities for us to continue in this conversation. So I'm going to ask now Dr. Deborah Holden, who is a key partner in all of this work that we've done here in the city of Flint in the last few weeks. She carries many distinctions, but I want to emphasize today that as a member of the Michigan Corona Task Force on Racial Disparities and also a member of the Greater Flint Coronavirus Task Force on Racial Inequities, and she is also a co-director of the Healthy Flint Research Coordinating Center. She's been very involved in communicating some of the epidemiological concerns and helping to work with the legal team to get us to this point today. because it takes all of us to make a difference. Again, it's our opportunity to learn today. And if you have questions, we're going to ask you to put those questions in the queue and be ready for the team to respond. So Dr. Deborah, will you take us further in this conversation today?
Sure, this will take me about 15 seconds. I'm going to hand it right over to our wonderful colleagues. And I know there's a whole lot of conversation right now happening around the settlements. And I really appreciate, because as you can imagine, for the attorneys involved in this, while we as a community have been facing this for over 6 years, they joined the fight about 5 years ago to make sure that something was being done that would help to restore us to whole. So I want to turn it over to my great colleagues who've been intimately involved in this, Michael Pitt and Teresa Bingman, two of our heroes. I see we've just been joined by another one of their colleagues, Trishelle Young. I want to hand it over now to Michael, who's going to walk us through the 7 pillars of the settlement, give you all a better sense of the work that's been done, what we can count on from here forward. And then we want to leave some time for you all to ask questions at the end. So thanks, Yvonne and Michael, if you could unmute yourself and give us the rundown. We really appreciate you. And we know this has been a long road and that we're not done, but thank you.
You're very welcome. Thank you. Thank you, Deborah. So the settlement process began a year and a half ago, and we were face to face with the governor, at first the Snyder administration, and then subsequently, the Whitmer administration. We had the aid of some great mediators, Senator Levin and former Wayne County Judge Pamela Harwood. There was also a special master appointed by Judge Levy, and there were attorneys representing individual claimants, as well as attorneys from the Attorney General's office. And the process, resulted in what we call a preliminary agreement. It's preliminary because there is a 45-day window where the details of the compensation plan will be worked out. We will be talking directly with community leaders like Deborah and Dr. Mona and others about some of the particulars in the compensation plan to improve it and to make sure that it meets the core principles of fairness, equity, parity, and non-discrimination. I also want to point out that in addition to being preliminary, it is partial. So I had the opportunity to listen in on the Facebook press conference that just completed, where Councilman Mays, some of the concerned pastors, and some of the others, former Mayor Weaver, were expressing their opinion that the amount of the settlement from of $600 million is not enough. It's inadequate. Well, we agree with that. We agree completely with that. That's why it's a partial settlement. Ted Leopold and Teresa and Trishelle were all part of a legal team that now has our focus on the remaining defendants, 2 consulting engineering firms, and the EPA. They will be targeted. They will be held accountable. We feel confident in our cases against them, and these responsible parties will be making a contribution to the overall settlement of the case, and so that the people of Flint will get a more fulsome recovery out of this. So, that is something that we are dedicated to do. The cases against those entities are well underway. They've been very well developed. Scores and scores of depositions have been taken. In fact, when you folks hear of some of the revelations that have been uncovered in the deposition process, I think you're going to be shocked and mortified and outraged by some of the things that you will hear that was going on behind the scenes with these engineering defendants. So let's talk about the pillars. So number one is broad coverage. As class counsel and interim class counsel, it was our job to make sure that the interests of the many outweighed the interests of a few. There was effort to push some of the settlement money into smaller groups. We argued for broad coverage. We recognize that there are many impacted groups. There are, of course, the children. There are adults. There are property owners. There are business owners. And we were tasked with making sure that the settlement and the compensation plan had the broadest possible coverage that we could arrange for. And we're very pleased to say that there is broad coverage in the compensation plan. As we indicate, as I already indicated, item 2, that this is preliminary and partial, and this settlement, we would not have agreed to this settlement if it was complete or if it was not partial. We insisted on this, and we were able to deliver to the community a preliminary and partial resolution of the claims against the state of Michigan. The plan is designed to provide the greatest compensation to the most vulnerable group, which of course are the children. 64.5% of the settlement goes to children 6 and under. Deborah and Dr. Mona and others, of course, recognize that the younger the child, the more vulnerable they are to the deleterious effects of lead exposure, and the settlement follows the science, and there really was not much of a disagreement over that part of the settlement. There's also 80% of the total settlement goes to the children. So there are 3 groups of children. That there are the children 6 and under. They're the group called the adolescents, which are 6 to 10, and then or I think 6 to 11. And then we've got the teenagers, like 12 through 17. And there are methods of compensation for these groups that are still being considered and are going to be developed during this 45-day window. The fourth pillar is equity and equality. All of the claimants will be treated equally in the sense that if you meet the criteria for an award, if you meet the profile for an award, that is what you will receive. There's been some discussion in the media and since the announcement that is this a class resolution or a not class resolution. Clearly, for the adults and the property owners, it's officially a class because of the nature of the minors. The court was concerned about calling it a class, but it is being treated as a class in the sense that every child, if they're part of the class or if they're part of individual representation, they're all going to be treated the same. To participate, you must file a claim, and if you present a particular set of facts that meets the profile, you will receive that award. It makes no difference if you have Ben Crump as your lawyer or John Doe as your lawyer. Each child is going to be evaluated on the merits of his or her claim, not the lawyer who brings the child to the claims process. And we fought hard to make that happen. It is going to happen. There's going to be no discrimination. There's going to be no favoritism. There's going to be equality. There's going to be parity. The attorney fees are going to be paid, are not going to share the attorney fees with attorneys, I should say, children are not going to share their settlement with the attorneys. The attorney fees will be authorized by the court at a certain level, and this will be determined at a later time. But each attorney who represents a child will get a payment from the fund so that Johnny and Sally and Billy, all who are similarly situated, all get the same net amount at the end of the day, so that everyone is comfortable with the outcome, knowing that there's no discrimination or favoritism. Also featured in the settlement agreement is a series of appeals. So if a child or an adult or a property owner feels that they were misclassified in the claims process, that they should be in a higher category, there will be a series of internal appeals that can be pursued to make sure that there is due process in the compensation plan. And finally, there is going to be an opt-out opportunity. And what this means is that if a member of the Flint community is not satisfied with where they fit in the compensation plan, when they understand what their award is likely to be, if they're dissatisfied with that, they can exclude themselves from the compensation plan, and they can proceed with other legal options as they see fit. They, of course, should get counsel from a qualified attorney, because there are consequences that they need to understand what those consequences are before they decide to exclude themselves from the compensation program. We anticipate that there will be some opt-outs. We also anticipate that there will be thousands of people who will be very satisfied with this opportunity and will take advantage of it. But in any case of this magnitude, there are always going to be people who are dissatisfied, and those opportunities for exclusion are part of the program. Said another way, nobody in the city of Flint is going to be required to take this compensation award It is, to a large extent, voluntary. If it's right for you, you participate, and you can get your matter resolved probably sometime next year. If you elect to pursue legal options, it could be many years before your case is resolved, especially in light of COVID, because COVID has pushed all the civil cases to the back burner. And when the courts open up, all of the criminal cases are going to go first, which means those of us who have civil cases may have to wait several months or even years before our cases will be heard. Very unfortunate situation, but that is the current status in the Michigan courts right now. The fifth pillar is everything that we're describing here. This compensation plan is going to be approved by the court. It's not going to be final until Judge Levy and other judges review it. They hear the concerns, complaints, compliments. They may call upon experts to express opinions as to the reasonableness and the effectiveness of the compensation plan. But at the end of the day, it will be a judge who will approve the settlement plan. And that again emphasizes the preliminary nature of what we have presented to the people of Flint. Let's go to the next slide. Who's ever in charge? Okay, thank you. So I just wanted to point out number 6, that this was a court supervised negotiation process. It was a result of 5 years of very intense litigation. The state of Michigan appealed every ruling against it. We were in the various appellate courts probably around 15 times. Michigan Court of Appeals, Michigan Supreme Court, Sixth Circuit Court of Appeals, the Supreme Court of the United States. Probably 30 judges have reviewed this case, with some exceptions. All the judges have found a way to make sure there's a remedy for the people of Flint. And so everything that we've done has been validated by the judicial process, and including having the eyes and the ears of Judge Levy right in the settlement conference room through the special master. The special master was present at most of the settlement discussions. And although she didn't report to the judge some of the details of what was being discussed, the special master did report to Judge Levy the progress that we were making, and gave her an overview of what some of the issues are that were being discussed. So it was done. The settlement was negotiated with court supervision. There was no collusion among the attorneys. God help us, no, there was never any collusion among the attorneys, I guarantee you that. There was a lot of disagreement among the attorneys, and there was some heated discussions, but at the end of the day, we were able to come to terms, and it was done with court supervision. And then finally, the 7th feature is, so the 7th pillar is that we are really proud that about $12 million is going to be paid to the Flint community schools to provide services to the children who are most impacted by the crisis. And I know that the school ACLU case was resolved yesterday as well. I read the announcement of it, and so we're very pleased to hear that we're working together with the ACLU to help resolve that issue as well. Many of our clients in our case overlap with the ACLU beneficiaries, and so we were going to be working very closely with the ACLU to make sure that everything goes smoothly in terms of delivering the money necessary to provide for these support services. The settlement also includes a $35 million set aside for what I've referred to as the forgotten children. These are the children who will not, for whatever reason, be making timely application for compensation. They could be children who are in foster care. They could be children from homes where the parents are not particularly well informed. Families have moved away. Any number of situations that could prevent a child from making an application. Of course, the child is dependent on an adult to pursue this for them, and not all adults are motivated to do that. So recognizing that, we've set aside $35 million placed in a trust fund, and when a child who turns 18 realizes that he or she missed the boat on the compensation plan, they can make a delayed claim to the fund, and whatever they would have received if they had made a timely complaint, they will, or timely complaint, claim, I should say, they will receive a payment that mirrors what they would have received with a timely claim. That's the structure. We are very proud of the work that we've done. We're also very enthusiastic about making sure that the other culprits are held accountable. That we hear some members of the community who say it's not enough. As I said, we agree. That's why it's partial, and we want the community to get behind us to help us make the full recovery that the people of Flint are really entitled to. So, with that, I'll turn it over to Ted or Teresa or Trishelle.
Great, Michael. I'm going to jump in just one quick second. This is Deborah Verholden, and true to our tradition, we like to start and end our webinar on time. We have many questions in our Q&A. We are going to go over, but I want to just complete out the Q&A, and our fabulous slide person, if you could just flip to the next slide real quick. I just want to remind our folks, we've got 3 other main messages that we try to bring home. Next slide. And that is, please stay safe and honor the protocols. We need to be counted. 10 minutes, 10 years of funding. There's more than $1 trillion at stake for Flint. If you haven't completed your census, go to my2020census.gov, and please make sure that you register to vote. If you haven't registered, do that. If you have registered, register somebody in your life. Make your voting plan. If you need an absentee or mail ballot, do that work now. Your voice matters. Last slide. And then we just encourage everybody, like and subscribe us on our Healthy Flint Research Coordinating Center site on Facebook. You can also join us on YouTube. And just so you guys know, there are many of our listeners who choose to watch this streaming live on YouTube, and I'm sure they're doing that. And then you can also get your questions answered by emailing us at info@healthyflint.org. And then fabulous, Tay, if you would just go back a few slides to the first slide. I'm going to turn it back over. Keep going back. Keep going back to our slide with the big snapshot on the settlement. Back 2 more. And then what we're going to do is hand it over to Ted Leopold, who I know has been a major champion for this effort. And then he'll hand it over to Teresa. I do ask you guys if you could look in the Q&A. We have some really great questions that people have asked, and I hope we have a chance to get those answered before you guys drop off. And again, thank you, Ed.
Dr. Deborah, just one other quick thing before we go. Just want to make sure that those who are joining us by YouTube, will they be able to continue to view this, or will they we'll keep the YouTube open so they can continue to view,
Yep, we will continue the
just so
live
they can know.
till we're done.
Okay, all right.
Okay,
Thank you.
great. Thank you, Ted. I
Thank
know
you.
you're super
Thank
busy.
you. Thank you, Dr. Verholden. I appreciate it. Thank you for the introduction. And Yvonne, I got on a little early. I was listening to you talk, so I appreciate your comments and your kind words, and also the comments of the governor. So we appreciate it.
Thank
It's
you.
been as I've told Mike often, it's been an honor to be a partner with him and be co-lead counsel appointed by Judge Levy in this very, very important litigation for the Flint community. Mike has really touched upon the key points of this settlement. So let me go on a more, 10,000 foot view, if I could, a little bit on the importance of why this particular settlement is so important to this community at this point. As Mike indicated, this is a partial settlement. We are hoping at the end of the day that there is going to be more justice for this community through the remaining defendants that are there. We are working as we speak on litigating against those two major private engineering firms in order to bring a full measure of justice to this community. As I said yesterday in our press conference that we had, if we as attorneys can do divine justice, we would do it. We'd be able to sort of go back in time before this decision by this governor or the prior governor, Governor Snyder, was made, and his MDQ and other representatives, and we would make sure that none of this happened. But really, there's only one person that can do divine justice. It's nobody on this Zoom call or watching. But what we can do in our system of government, our civil system of government, is provide justice. And we provide justice by providing a monetary award. That is all that we can do in the civil system, and to make sure that the right questions are asked, we get the answers, and the right individuals or parties, or in this case, the state, is brought to the point where they can make come forward and be known that their actions cause terrible problems within the community. So when we say that this is a partial settlement, is it, as Mike said, all the money that we wish we can provide? No, it's not. But it's a measure of justice that will begin to bring some closure to this community. The thing that we have to try and stress to the community, which is so very, very important, is yes, we could refuse to accept this settlement, or people who may want to opt out of this settlement and go forward. But this community has suffered for years already. This happened in 2014. So the people have suffered for years and years. And to go all the way through trial with the remaining parties of the state, if we weren't to accept this, you're looking at years and years of more litigation. You're looking at years of appeals in order to get closure. And some of us, I dare say, may not be around by the time all of this is ending up to be brought to a close. So we want to bring closure sooner than later. We want to get something to help this community now. And we believe the $600 million does that. And that's what we want the community to understand and appreciate what we're trying to accomplish, with the hopes that in the near future, whether through another settlement or through a jury verdict against the private engineering firms, we will establish more funds in order to help this community. So I think we have done we've worked very hard to try and establish equality in a non-discriminatory way to provide justice for everyone. For this particular settlement, almost 80% is going to minor children. That is going to provide abilities for these children who have been affected by the lead-related issues and the bad water, and to the community to get some help, some guidance. And we also have money that is going to property owners and to businesses. So we think that we have touched all of the areas in order to get this first chapter started, with the hopes that the last chapter will happen sooner than later. But we just think that this is a great start and something that the community hopefully will rally around and get behind, because this community, more than any community in the country, needs to move forward. And we look forward to working with everybody that is out there in order to facilitate the claims process, to answer questions, to represent those who have no representation right now. And we will do all we can to make sure that justice occurs to this community and to those that have been injured by it. Thank you, Dr. Deb.
Okay, great. Do we want to hear from Attorney Bingman or Attorney Young? Anything you'd like to add? I would like, if you guys could give us a few more minutes, a chance to ask and get some of these questions answered as well. Attorney Bingman.
Yes, Attorney Young is transitioning to another meeting that I'm supposed to be on as well as Michael and Ted, but I would like to at least say thank you to a few people, and I hope that we get the opportunity to talk with your group again so that we can answer questions. The ones that you have available now in the chat, if you could email those to me, Dr. Deborah, we'll get the answers back to you, and then hopefully we'll be able to join you. So my thank yous are to you, Dr. Deborah, Dr. Mona, and your entire team. You all have been fantastic partners in this effort. We really needed to be educated. We needed the science from your research, and you have been very accessible and knowledgeable on this. So what you have done has gone a long way in terms of us making sure that we have a settlement that is fair. And I also want to thank Ms. Yvonne. She has given us access to the community through her radio show, and she has educated us as well. We've had some good conversations. All of you are always fighting for the best interest of the people of Flint, and we're glad to be your partners. So we would love to come back and talk again, and we will answer the questions and email those back to you.
Okay, great. All right, great. So I give my word to our folks that we will have all of these questions answered and many more. And I do want to point people to the number 866-536-0717 if they want to sign up, if they want to get their questions answered. There's also a great resource that you all have put in place, a website, www.flintwaterjustice.com. That's www.flintwaterjustice.com. Similarly, for those who prefer to get things on their cell phone, you can also text Flint, F-L-I-N-T, to 47177. And I know, and they don't know, a lot of folks, that you guys have been here all along. And the great thing about having such powerful champions locally is that you'll be here even through this partial settlement once that is done, until this has seen its logical legal end. So I encourage people, log those resources. These attorneys are not going anywhere. They didn't parachute in and are going to parachute out. They are here to make sure that we are not further victimized as a community during this settlement and restoration process. So thank you all. I promise our people that we will get their questions answered. I'm going to hand it back over to our moderator who will close us out.
Right. Thank you, Dr. Deborah. I want to say again, I appreciate Teresa, Michael, and Todd. Thank you so much for being with us today. We know you had a number of other things that you need to do and you have to jump out the webinar, but we appreciate you. And we want to say to every one of our panelists, our other panelists, as well as our attendees, without you, this would not be possible. We'd just be talking to ourselves. But you make it valuable because you provide these questions. And I do trust, and I honestly believe, because you share that feedback, you're sharing what you learn on this webinar with other community members. I want to encourage you to complete the pop-up post-webinar survey. It does help us to get information that you're needing. It allows us an opportunity to contact people who can respond to these questions for you. So please complete the pop-up survey for the webinar. And I also want to encourage you, join us next week. Our goal will be to have some of these questions answered next week, August 28th. And don't forget, send in those additional questions to info@hfrcc.org. Thank you all again for tuning in. For those of you that tune in live to the YouTube stream and you're visiting again, we want to appreciate you. And again, thank you so much. Join us next week. We'll look forward to participating with you in this process. Have a wonderful week.